Vaccination in at-risk patients. What should you know? Your pharmacist informs. Vaccination against infectious diseases in at-risk groups may be either specially advised or contraindicated, depending on the patient's underlying disease or immune status and the type of vaccine. When speaking of patients at risk, we can distinguish between risk group and risk situations. Risk groups include people with immune system deficiencies, such as, for example, oncology patients or transplant recipients undergoing treatment with immunosuppressive drugs. Chronically ill patients, such as those with diabetes, cardiovascular or respiratory disease, among others. Institutionalized persons, such as residents in social and health centers or prisons. And some other cases, such as people with Down syndrome or in prolonged treatment with acetylsalicylic acid or anticoagulants. On the other hand, some work environments are considered to be at risk, such as the staff of child education centers, health personnel, or caregivers of elderly or high-risk persons. Pregnant and breastfeeding women may also be considered at risk. Most commonly, given the safety of vaccine, they are specifically indicated to certain groups and situations of risk, and there are few situations in which vaccination is contraindicated. For example, measles, mumps, rubella, and varicella vaccines are contraindicated during pregnancy. In immunocompromised patients and in patients with HIV and a very low CD4 lymphocyte count, less than 200 per microliter. The reason is that these vaccines are composed of live attenuated viruses and the immunodeficiency situation does not allow the development of an adequate immune response. The influenza vaccine, on the other hand, is usually recommended specifically for all risk groups and also in most risk situations, including pregnancy. In the case of vaccination against COVID-19, the Ministry of Health recommends administration of additional doses for people who, due to a compromised immune system, are unlikely to achieve a sufficient degree of protection with the recommended schedule for the general population. This recommendation extends to persons over 60 years of age, institutionalized persons, and social and healthcare personnel who were in contact with groups at risk. To know the recommended vaccination schedule for the year 2023 for people at risk, you can consult the official information published by the Spanish Ministry of Health, whose links are included in the description of the video so that you can access it directly. And remember, always ask your trusted pharmacist. We will help you and answer any question you may have about vaccines.
Remember, for any queries, go to your pharmacy and ask for advice to your pharmacist.